Hi, I'm Dr. Mark Stengler. In this short video, I want to talk to you about the dangers of using non-steroidal anti-inflammatory drugs, also known as NSAIDs. And did you know that 40% of people over the age of 65 in the United States use prescription or over-the-counter NSAIDs to treat pain? And so that means there's a lot of people taking these non-steroidal anti-inflammatory medications. And so the research shows that these medications, especially when used long-term, can have quite the damaging effects. And so you're probably familiar with things like obviously aspirin, ibuprofen, naproxen. These are the classic NSAIDs that people take over the counter, and there are stronger versions that can be prescribed to patients too. Now, what I should tell you is that, look, research has also shown that these medications are very effective for treating pain and certainly are a lot safer than the opioid drugs, which have been used so much over the past decade, which doctors are getting away from now. But let's look at the history of using NSAIDs. In 2005, the FDA mandated that all prescription NSAIDs include a boxed warning of the risk of increased risks of cardiovascular disease and gastrointestinal bleeding. In 2015, they heightened the warnings regarding cardiovascular risk with NSAIDs, as well as aspirin, including the risk of blood clots, stroke, and heart attack. And so again, these obviously are things that are very, very concerning. Other adverse effects with NSAIDs can include liver and kidney damage. For example, one study found that people with high blood pressure used NSAIDs for 90 days or longer had a 32% increased risk of kidney disease. The FDA has even mandated that labels of these medications state that the risk of heart attacks or stroke can occur as early as the first weeks of use. And according to some recent research, also there is the condition known as ototoxicity. That's basically damage to the ears, the inner parts of the ears involved in hearing. So people can actually end up with hearing loss. And we've known for a long time that aspirin especially increases the risk of tinnitus, which is ringing in ears. So the issue with NSAIDs is, if you're going to use them, obviously they should be used only for short-term use. Anything for more severe pain, for chronic use, should be under the guidance of a doctor. And of course, I'd always recommend, if possible, use natural pain relievers. We have many great things in the supplement world which can also help to naturally reduce pain. In addition, there's many types of body work that reduce pain, things like chiropractic, physical therapy, osteopathic, laser therapy, many things you can use to reduce pain. So you should really be focusing on these things as much as possible and using NSAIDs less. And then lastly, if you need to use NSAIDs, there's also ways to use them topically as topical creams or gels you can talk to your healthcare provider about. But again, in the natural realm, we have very good natural pain relievers too. Something we're finding that's working well with patients in recent times is the topical use of CBD. CBD creams and gels are working very well for people as a topical treatment as well. So be aware of the risks with NSAIDs, especially long-term use, and try and use natural alternatives as much as possible.